So what mechanisms might there be at work? This comes from a paper by quite a well-known health economist, Richard Scheffler, and he suggests there are about 4 different mechanisms that potentially link social capital to health. And these are, the first one is to do with information. And with more social capital, more information typically is available to members of the community. Because if we're seeing social capital as a sort of network and a set of relationships between individuals and between different groups, the more people that you are in some form of relationship with, the more opportunities you have, perhaps, to get information. In the extreme case, suppose you don't know very many people in a particular city, and you then need to know how do you access health services, or where are the best places to go. You may find it quite difficult to access health services if you haven't got information. Whereas if you have lots of different contacts and people that you interact with, 1 or 2 of them may be very informative about what you need to do, or the best time to do it, or the best places to go. So that would be an example. So more relationships, more social capital, and more people you trust. You trust what they'll tell you. There's more people to ask, there's more sources of information, and we tend to think if we have more information, we'll take better decisions. And in a health context, if you're taking better decisions, one imagines better decisions about your health, it's going to lead, one hopes, to improvements in health.
Oh, excuse me, how about the misinformation?
Yeah. Well, one way of handling that, this would be a cheap way to duck out of it slightly, would be to say, well, there's some people you really shouldn't trust. And these people, and you might have some sort of knowledge of them or relationship with them, but you shouldn't be trusting them. And so it's not actually genuine social capital. But I think it's fair to say your question deserves a deeper answer than that. And I think the slightly deeper answer is to recognize that not all social capital is necessarily beneficial. It comes back to the idea, are there different types of social capital? Now, this is an extreme example, but suppose you are an injecting drug user. The more contacts you've got, the more easily you will be able to access the products you like to inject into yourself. Now, we've been saying more contacts, the more people you trust and the information they give you, more social capital. So these particular increases in social capital for an injecting drug user are not leading to better health outcomes. They're leading to, or potentially leading to, poorer health outcomes. So I think the point is entirely right. Not all social capital, depending how we measure it, but not all social capital is necessarily good for health. We'll come to another example just below that, social norms. So in some descriptions of social capital, it's in terms of social norms, and there's a view taken that the social norm can be a way of influencing people's behaviour in a very positive direction. But we can also think that the social norm might go in the wrong direction. Suppose the social norm was to act in a discriminatory way against groups that weren't part of your particular culture. That might be the social norm, and clearly in some countries, sometimes in history, that has been the case, that the social norm was one of discrimination. Now that's not going to generate good health outcomes. Thinking the more positive one, and the usual way we look at social norms, one example would be restrictions on smoking in public places. Now, again, I have to apologize for my lack of knowledge about Japan, but throughout much of the world in the last 10 to 15 years, there has been increasing amount of restriction on smoking in public places. So much so, when I walk into a restaurant or cafe or something in Japan and people are smoking, part of me goes sort of involuntary jerk. And it's not because I've got I don't smoke, but it's not because I've got a sort of, I can't stand the smell or anything. I'm just surprised. Because starting in about, get my dates right, I think Norway actually is one of the first places to ban it from bars and restaurants, probably about 2002. Ireland was about 2003. Scotland was about 2004. England, I think, was 2005 or 6. And lots of other countries have joined in. Even France, to some extent, is restricting smoking in public places. But anyway, that's so. The example here is this: that now people from Britain think the norm is no smoking or very limited smoking in public places. Go back to 2000, and it wasn't at all the norm, not remotely. I mean, it might be some restaurants, some might have had one part that was smoking, the other part was non-smoking, although I don't know if any of you have noticed the way that smoke does actually go through the air, and so having a non-smoking half and a smoking half is not very different from having smoke everywhere. But that social norm has changed so much. And that's an example, I would say, of it's a very positive one for health. For health. I guess even in Japan, there's some restrictions. I'm thinking of airports. I've seen you walk past sort of ghettos for smokers, sort of glass enclosed areas. But that's a positive one. So the social norm has potentially beneficial impacts on health. As I say, you could have social norms, such as some form of discrimination, which is bad for health. The third one here, enhancing the healthcare services and their accessibility. Interestingly, when I was just looking at my lecture, as professors do sometimes, look at their lecture notes half an hour or an hour before they're about to give a lecture, I noticed I hadn't given an example. I'd obviously opened the bracket, thinking, I'll put an example in, I'll do it later. And then I hadn't done it. And I think there's a reason there. When I think about this one, about enhancing healthcare services and their accessibility, the examples I keep thinking of, a lot of them are to do with information. A lot of them are to do with maybe social norms. You know, having a social norm, universal access to healthcare. I think it has become, in most places, a social norm. And so I have difficulty coming up with a distinctive example where the social capital enhances healthcare services and the accessibility to it. That's not to do with information. That's not to do with some form of social norms. Maybe you can give me an example.
I come up with an example.
Please.
In the old days of China, maybe in the start of new China, there are some villages, they start to build like clinics, the village clinics. Before that time, there's no such clinics, but at that time, some villages began to build up some village clinics for common use. The people in that village can use the medical resources freely.
Okay, and so I think that's a good example. So that means possibly the villagers trusted each other enough that they would work together, because it would take sacrifice and effort to, build something that can provide health care. And they trust that they will then be able to get access to it themselves. And so that, the social capital here is the trust that led to the cooperation between the villagers.
I think that is the very start of the health insurance.
Yes, that you can do more by spreading risk or sharing risk with others. So you're saying that not only did China invent paper and gunpowder, they invented health insurance? It's possible. I don't know. Yeah, so I think that's an example. So, but because of the existence of enough trust, that led to the activity, which then meant that there was some level of healthcare provision and accessibility of health services, which otherwise wouldn't have been there. Any other examples?
Professor, I don't know it's an example because in my country, Taiwan, we have the national health insurance. That health insurance, the coverage rate is up to 99% in Taiwan. And you don't need to pay so much money in per month. It's very like the insurance fee is like very cheap. And if you have the work and the company, they will pay you like 70%, and the user only need to pay like 30%. So to us, like health services like very accessible to us because you go to a hospital, you go to the clinic, it's like very cheap to us.
Right, and do you think that sort of system has developed partly because of the social capital that exists, or back then existed?
Yeah, 99%, but we have some financial issue, of course.
Right, yes. Okay, thank you. Right, so there are examples here. I can now put something in there and close the bracket for next time. And the fourth mechanism that Scheffler identifies is in terms of offering psychosocial support networks. The more people you have, more relatives, more friends, more family members, or the better you get on with your neighbours, the more volunteers there are in a community, the more supply of informal care there will be available. So that's another mechanism. Right, so graphically, just what he is saying, and he wants to emphasize, is as a consequence of social capital and higher levels of social capital, through these four mechanisms, we anticipate beneficial impacts on health. But he's very keen to emphasize that these changes in health are then going to feed back into the social capital. And I guess, if we stretch our example, if we're thinking of our Chinese village, if they then have better health services and health does improve, the villagers are then better able to maintain those services or indeed to expand them. And as a result of a successful cooperation, perhaps people trust each other all the more, and so social capital is increasing, which is a very sort of optimistic, rosy view of the world. Remembering these things can go in the other direction. If there's not enough trust, perhaps people become indeed less trustworthy, and the fact that the social norm becomes don't trust people, you go in the opposite direction, and things are getting worse and worse. Just in passing, as I was emphasising on Friday, we've got community social capital, we've got individual social capital. Just what the relationship is still slightly up in the air. And the question I closed with one of the questions I closed with on Friday was, is community social capital just the sort of aggregation of individual, or is it something distinctive? Sheffield doesn't answer that one.